Accompaniment work means that we must support people who are living with HIV and AIDS are on treatment. ARVs have been made accessible through the Global Fund and the PEPFAR program. So there's no excuse that people cannot access treatment. But with that, we need to make sure that we train community workers who are called now adherence supporters. They will encourage people at community level to make sure that they're taking their treatment.
Yeah, the context in India brings few areas of accompaniment. First area was the people living with HIV coming to receive ARV medicine from faraway places to the nodal center required a temporary shelter. Especially during COVID, they found it very difficult, and churches were not ready to help them. And so that was also a time when we realized that whatever interventions happened in churches at some point with regard to HIV, it all happened because there were funds available and churches didn't own the problems. So it is a need area to accompany churches with regard to HIV, where they will internally look at their own competency and take it as an essential part of their ministry, whether they are in a high prevalent area or in a low prevalent area. The second area of accompaniment we found was related to taking care of the aged people living with HIV, where churches have to understand that as a problem, not necessarily within the church, but it's around, because India definitely has the second largest number of people living with HIV, and who is going to take care of the aged. So churches can play a key role in bringing out a change in the society among the faith-based response in India.
In my context, I believe that it is true ARVs is available, but churches need to help people living with HIV to have access to food, because without food, I don't think someone can be observant and can be treatment adherent. And also, we need a space where faith, churches, governments, states, and associations of people living with HIV can come together and discuss, listen to each other, and be able to find solutions to the common issues they have. Thank you.
The issue of stigma is still a reality in Africa. So people deny. When someone is HIV positive, they try to hide because of the stigma associated to it. So that's why I encourage churches to continue creating awareness about these issues, but also continuously, mobilize church leaders to continuously speak about these issues, so that people can take it as something which is normal, it's life. So the issue of stigma must be addressed, and creation of awareness must be continued. Again, also because of the mental health of those people suffering from, or those people who are HIV positive, there is a need of psychosocial support, where support groups, peer support can help a lot in comforting and encouraging those people who are HIV positive. So the whole aspect of psychosocial support is needed, where churches can create safe space for people suffering for people who are HIV positive to feel better, to feel good, to feel accompanied, to feel cared for.
The Church of Scotland supports a programme called Positive Help, and one of the areas that they work in is supportive transport. And supportive transport is when volunteers are trained to take people living with HIV to hospital, perhaps for shopping, perhaps to other appointments that they wouldn't be able to go to otherwise. Most of the people that are supported by Positive Help are the vulnerable in our communities, and the friendships that are formed through the volunteers, and many of the volunteers are church members, the friendships are a lifeline for people living with HIV in their context, in the vulnerable situation that they might find themselves in. Many other people in Scotland who are living with HIV, it's very much a medical model where people in that model, they're able to care for themselves, they're able to take their medication and live what they see as a normal life, and which is a normal life. But there are vulnerable people in our community, and walking alongside them, and the church doing that is really, really important. And as more migrants and more asylum seekers come into Scotland, this group gets even larger, and we need to look at ways in which we accompany our asylum seekers in Scotland too.
Stigma and discrimination in the Indian context was not necessarily related to HIV. Because culturally speaking in India, we find it taboo to talk about the body per se, the human body. And so people are not comfortable to talk about the problems they face in their bodies. They may be comfortable to talk with a doctor, but the context in India is we have a large, dense population and few hospitals. The hospitals have long queues, and the doctors don't have time to deal with a patient more than maybe 1 minute to 2 minutes, because there's a long line waiting outside. So it is a need area to look at how we can talk about holistic health, how churches can play a key role in looking at itself as a body of healing, a community of healing, where it can look at its own invisible health assets of people who can take care of people who are suffering, especially in a context where there are fewer hospitals and a high population. So a revival of congregational-based healing ministry in our context, where we are technologically more integrated and fast, is a possibility where we look at mapping the internal invisible health assets in a church, whether it be in a urban, suburban, or even in a rural area. That's possible. So these are some of the issues related to Accompaniment.